Can we prevent retinal tears? Let's talk about it. Hi, my name is Zach Oki. I'm a retina specialist here in Irvine, California. The short answer to the question is unfortunately no. How do retinal tears happen? Well, above me you see one right here. Do you see the retina's ripped right there? And there's a little flap. What's happening here right there, attached right there, is the vitreous. The vitreous is a connective tissue-based substance that fills the back of the eye. It's actually mostly water, but about 3% of it is made out of things that keep the body connected. Things like collagen, elastin, chondroitin, etc. All of these things are found all throughout the body, and when they change over the course of time, one event happens called a posterior vitreous detachment. If you're cool like us, then you call it a PVD. When the PVD happens, when the vitreous separates away from the retina, for most people, it's a totally benign experience. People see floaters and flashes. They tend to go away. Everyone ends up okay. But then there are some people, particularly nearsighted people, who are at higher risk, where the vitreous, when it separates away, it actually pulls hard enough on the retina like this, and it creates a retinal tear. In other words, if we ask the question, how do we prevent a retinal tear, we have to ask, how do we prevent the changes in time that happen to the connective tissue? There's nothing that changes that. A lot of this is bad luck, but also, like I said, if someone's nearsighted, then they're at higher risk because of all the geometry from a longer than average eye. And someone cannot tell on the basis of symptoms alone whether or not they're having a retinal tear or not. That is, people with retinal tears and without retinal tears develop floaters and flashes when they happen. And therefore, we always have to suggest getting a dilated eye exam to detect a retinal tear and treat it before something like this happens, a retinal detachment. This person's retina is detached all the way from here up like that. And this person actually underwent surgery with me and we fixed it, no problem. But you certainly don't want to wait around for a retinal detachment. Even though this person had a great visual outcome, some people have a lot of trouble with it. Retinal detachments are life-changing things, so it's really important to prevent them.